If you have long COVID, you need to stay hydrated, but you also need to know that water doesn't work. You need a hydration strategy that is specific for your symptoms. And that's what we're going to talk about today. Welcome back to Long COVID MD. I'm Dr. Zeest Khan. I'm a licensed physician with long COVID. And here we talk about the science behind long COVID and treatments that are readily accessible so you can get relief right away. Using fluid strategically can be an effective treatment for long COVID symptoms, particularly orthostatic intolerance caused by dysautonomia triggered by the COVID infection. Let's break it down. Certain infections, in this case COVID, can trigger dysautonomia. That's where the autonomic nervous system doesn't work as well as it typically does. The autonomic nervous system is basically the conductor of the orchestra that is our body. Particularly, it triggers responses that increase our blood pressure and change our heart rate depending on the position that we're in and our activity level. What happens for people with long COVID, including me, is that we struggle with a consequence of dysautonomia called orthostatic intolerance, where we have a hard time going from lying down to sitting up to standing up. We have trouble maintaining enough blood flow to our brain when we start fighting gravity from lying down to sitting up to standing up. People like me can suffer from dizziness or even pass out just by changing position. And this, as I don't need to explain anymore, is a debilitating condition. Luckily, the symptoms can be managed and offset by increasing our fluid intake. Fluid hydration has been an important part of my treatment strategy, and luckily I'm feeling a whole lot better now, and my symptoms are much more managed than they have been in the past. I have spent time flat on the bathroom floor staring at my floorboards because I was on the brink of passing out or experiencing syncope. And I had to lie down until that sensation passed and my brain got enough oxygen. This is something that otherwise healthy people don't have to think about. But when you have long COVID, it could be at the forefront of your mind. Am I going to pass out? Is it okay for me to even sit up? I used fluid hydration as a way to improve my symptoms, and hopefully you can too. So let's explain how. We probably all know that we need water for our bodies to function. We need enough hydration for our cells to work properly and for our kidneys to clear all of the metabolites that our body builds up and excrete that in the urine. When we increase how much water we're drinking, the body retains what it needs to make sure all of those functions are working, and then it excretes the rest through urine. But when we're talking about long COVID, we're not focused on how the cells function or how our kidneys function. We're also really focused on increasing our plasma blood volume to help offset the consequences of dysautonomia. As I've talked about in my last episode about IV hydration, our blood is composed of two main parts. One is the blood cells. That includes the red blood cells that carry oxygen to our organs. The other is the fluid part of blood, and that's called plasma. Plasma is composed mostly of water, but it also contains electrolytes and some really important proteins. Increasing our fluid intake, either by drinking enough fluid, and we're going to talk about the right fluid to use, or through IV hydration, increases the plasma component of our blood volume. Why is this important if you have dysautonomia? Well, when we go from lying down to sitting up, we're fighting gravity. Blood pools at our lower extremities and in our abdomen. Typically, our autonomic nervous system compensates for this change in gravitational pull by constricting our blood vessels and increasing our blood pressure to make sure there's enough blood flow to our brain. We can't rely on that mechanism when we have dysautonomia from long COVID. A portion of our blood is going to pool, it's going to leave our brain. What we're trying to do by increasing our plasma is increase the total blood volume so that the proportion of blood that is left over after gravity has had its effect is still enough to perfuse our brain. And that's going to reduce our dizziness, and that's going to reduce the syncope or presyncope, which is passing out or that sensation where you're about to pass out, from occurring. I'll link to my episode discussing ways I use IV fluid hydration to increase my plasma volume in certain circumstances. But for the most part, I depend on oral hydration strategies to keep my blood volume up. I don't get an IV every day. It's really important to know what kind of fluid to use for what purpose. So let's break it down. The first strategy is plain water. You can do something called a water bolus, where you drink a couple of cups of water before you have to stand for a period of time or exert yourself or stand around in a hot setting. These are all situations where you're at risk of having orthostatic hypotension, meaning your blood pressure drops when you stand up. When you drink 1 or 2 cups of water in one setting pretty quickly, it triggers something in your body called the osmopressor response. This means your blood pressure increases for about 30 to 60 minutes. So we can manipulate what we know about physiology to help us get through the day or get through a difficult task. I'll drink a couple of cups of water before I do something like take a shower, where I might be standing and my blood vessels might expand, and then my blood pressure decreases even more because the water is warm. If you want to learn about more strategies to get through practical things like taking a shower, I'm going to link a conversation I had with occupational therapist Amy Mooney, where we talk about precisely this. There are other strategies you can use to accomplish the things that you want to do. But remember, drinking water can be one of those tricks. Drinking plain water, though, has its limitations. The osmopressor response only lasts for about an hour at most. The next step or next strategy is to retain that water so that it's not excreted by the kidneys, stays in the blood vessels, and keeps that blood expanded. This is where salt comes into play. Salt is actually really important in the process of rehydration. This is because water doesn't actively move from your gut into your blood vessels after you drink water. Water doesn't move itself, it follows sodium. And sodium is the main component of salt. Sodium is absorbed in the intestinal lining, goes into the blood vessels, and water follows that osmotic gradient. It trickles between the intestinal cells and makes its way into the blood vessels. When we add sodium to our drinking water, more sodium is going to be absorbed into the blood vessels, and more water, therefore, is going to follow. Because there's more sodium in the blood vessels, the water stays there for longer. But there's one more ingredient we can add to take this process up a notch, and that is adding glucose. When glucose and sodium are present in your gut in the right proportions with water, water doesn't trickle down anymore. It's actually pushed into the blood vessels. This is because of something called the sodium glucose transporter. It's a channel that exists on the cell lining of our intestine. And when sodium and glucose are present in the right proportions, they bind to this transporter that's actually powered, and the sodium and glucose gets pulled into the blood vessels, and water binds also and gets actively pulled into the blood vessels. So having the right proportion of glucose and sodium and water is going to turbocharge your hydration and expansion of your blood volume. This is why oral rehydration solutions that are used in people with severe dehydration contain a specific mix of sodium and glucose and are added to water. The key is that sodium and glucose should be in a 1-to-1 ratio, or as close to 1-to-1 as possible. When we increase the glucose component to it, we are increasing the amount of glucose in our intestinal wall, and we might actually pull water into our intestine, and this can cause GI losses or loose bowel movements or diarrhea. This is one of the reasons, if you have kids or a little one who's been constipated, your pediatrician might have recommended something like prune juice, pear juice, apple juice to get things going, because it's actually pulling water into the intestine and moving stool through. That's not what we want to do when we have dysautonomia. We want the opposite. We want water going from our gut into our blood vessels and staying there. Luckily, these rehydration solutions are readily available. There are a few, however, so let's go through the different categories. Let's start with the one that has the highest level of sodium, and that is the St. Mark's solution. St. Mark's was created in the UK. It helped treated hospitalized patients who were suffering with dehydration from gastrointestinal disease or intestinal surgery. Because it has a certain level of sodium, this is the ideal solution to expand plasma blood volume. It is readily available in the United Kingdom, sometimes by prescription and covered by insurance. But luckily, it's also a pretty simple recipe, so you could concoct the St. Mark's solution in your own kitchen. If you're interested in the recipe and the specifics of the electrolytes that St. Mark's and all the other rehydration solutions that we're going to talk about today, subscribe to the Long COVID MD Substack newsletter. I'm going to link it in the show notes. It contains all of the details of what we talk about today, including all of the electrolytes that each formulation contains, the St. Mark's solution recipe. And for paid subscribers, you also get a handout that summarizes the entire newsletter that you can quickly reference anytime you need. The next oral rehydration solution we'll talk about is the World Health Organization's formulation. The WHO formulation has saved millions of lives worldwide, particularly in children who are dehydrated from gastrointestinal disease. It efficiently and effectively expands plasma blood volume and helps organs get perfused. It has that turbo boost action from the sodium glucose transporter that we really want to take advantage of. The WH formulation has a little bit lower sodium content than St. Mark's, but the ratio of sodium to glucose is still pretty close to 1-to-1. There is actually evidence that using the WHO formulation in particular improves symptoms of POTS, or postural orthostatic tachycardia syndrome. POTS is also a condition associated with dysautonomia. The WHO formulation is pretty accessible. I found mine on Amazon, and I link the specific brand I use in the Substack newsletter. But if you just Google WHO oral rehydration solution, I'm sure you're going to find a few options. You may or may not have heard of St. Mark's or the WHO formulation, but you most likely have heard of the next oral rehydration solutions I'm going to discuss. The first is Pedialyte. Pedialyte is really commonly found here in the United States. It has a sodium content that's almost half of the WHO formulation, but it's still really effective in treating mild dehydration in specifically children. That's what it was formulated for. It has a sodium glucose ratio of closer to 1 to 3. That's pretty similar to the next oral rehydration solution, which is Liquid IV. Liquid IV is also a branded rehydration solution that's sold in little sachets that you mix with water. It's branded for rehydration after exercise and for hangovers, but you can still be pretty effective if you're looking to increase your blood volume. And finally, the sports drink called Gatorade and all of the drinks that are similar to that. So, where St. Mark's, the ideal, has a sodium glucose ratio of 1 to 1, Pedialyte and Liquid IV have about 1 to 3. Gatorade and other similar sports drinks have a sodium glucose ratio closer to 1 to 25. There's a lot more glucose here, which may benefit athletes or people who are trying to replenish their glucose levels from physical exertion, but it's not going to be very effective at expanding blood volume. And too much glucose, as I talked about earlier, runs the risk of having the opposite effect and dehydrating you even more. So how much water and how much salt do you really need if you have dysautonomia? Well, we can look at the POTS research, which suggests at least 3 liters of fluid and 10 grams of salt taken throughout the day to help improve or offset symptoms of orthostatic intolerance. That's the goal I follow, but you can personalize it to your needs. It might be a good starting point to try to aim toward. But as with anything with long COVID, no two people with long COVID are the same. And it's really important to get in touch with your own body's needs and make sure that you know the signs and symptoms of what is helping and what is something that you can't tolerate. So let's then talk about the side effects or the cost of taking oral rehydration solutions. I like to think about treatments having a benefit and a cost instead of having side effects, because we know that every medication, every treatment is going to have side effects. Each one of us tolerates those side effects to a different level. And so we have to ask ourselves, is the cost of this treatment worth it to me? For oral rehydration solutions, the costs are pretty benign for the most part. These solutions don't taste great. There's a reason that the branded ones that are marketed and really popular have a higher glucose level because it's not enjoyable to drink salt water. But that's, something that you kind of learn to tolerate, or it might be a reason that you choose something like Pedialyte over St. Mark's. Because while St. Mark's is more effective, Pedialyte might be more realistic. 2, you are going to retain fluid. That is kind of the point to using these solutions, but, it's something to keep an eye on. And 3, even though these solutions are intended to increase fluid retention and reduce the amount of fluid that's excreted by the kidneys, you're probably still increasing your total fluid intake when you start a therapy like this. And that means you're going to be going to the bathroom more often. For a lot of people, this might sound like no big deal, but when you are bedbound and feel like passing out every time you sit up, that trip from the bed to the bathroom is not a small challenge. I myself have crawled in order to make that trip. And so I don't take the cost, this specific cost, lightly. I don't underestimate it. Apart from the side effects, we also need to discuss the real risks and the conditions that might make increasing your daily sodium inappropriate. So, conditions like heart failure, kidney disease, especially end stage kidney disease that is dependent on dialysis of any kind, pre existing edema. These are conditions that make increasing salt much more risky. As I discussed in the last video about IV fluid hydration, in people with conditions affecting the heart, liver, kidneys, changing our fluid and electrolyte balance can really tip you in the wrong direction and cause really detrimental outcomes. So before you increase your salt intake, have a discussion with your doctor or your medical provider, making sure that it is a reasonable treatment for you to try. Let me know your experience using oral rehydration solutions. Have they helped? Have they annoyed? Have they harmed? And let me know what other topics you'd like me to cover. I encourage you to subscribe to the Substack, either as a free or a paid member. And until next time, bye for now.